Hello there! Let's talk about ulnar wrist pain. Ulnar wrist pain is not caused by the ulnar nerve, because nerve pain typically feels like non-localized tingling, numbness, or burning. Hence, by definition, ulnar wrist pain is never nerve-related because nerve pain is never pinpointed to a small area like a wrist. If the ulnar nerve were involved, the pain would usually come with numbness or tingling in your ring or little fingers, as in the case of Guyer's canal syndrome, or burning or radiating sensation that travels down the inner side of your forearm, possibly all the way up to the elbow or shoulder, as in the case of cubital tunnel syndrome. These type of issues would be hard to label as wrist pain, and hence if one tells they experience this, nerve pain cannot be the cause. Therefore, the ulnar wrist pain is caused by either of these two reasons. Reason 1 being the flexor carpi ulnaris tendon injury, the tendon which runs along the ulnar side of the wrist and is responsible for flexing the wrist, assisting in ulnar deviation, and helping stabilizing the joint during pulling, curling, and gripping movements. And the reason 2 being the triangular fibrocartilage complex ligament injury, the ligament which is located deep in the ulnar side of the wrist and is responsible for stabilizing the joint during twisting, gripping, and other load-bearing movements. The way you self-diagnose which one of these two options you have is by putting a tight rubber band on your wrist and warming up the wrist well with very lightweight curls and then doing the exercise which hurts. If the pain alleviates due to the warming up and the pressure from the rubber band, then the cause is most likely the tendon, but if not, then the cause is most likely the ligament. This test works because tendons and ligaments respond differently to warming up and compression. Tendons improve their function, whereas ligaments not so much. Now, if the pain did improve with the rubber band and warming up, then the cause is most likely the tendon, and hence to protect it and let it heal, warm up the tendon properly before using it and have the tight rubber band on your wrist when you are doing any type of pulling, curling, or pushing exercises. Note that this includes chin-ups, bicep curls, and even the bench press, and everything that resembles these. Note that you can easily worsen the injury of the tendon even in exercises which do not directly target it if you do not protect it. Note that warming up helps in two ways. Firstly, because it raises the temperature in the tendon which makes collagen in the tendon more elastic, hence reducing stiffness and improving the tendon's ability to stretch and recoil. Secondly, because submaximal force preloads the tendon which aligns the collagen fibers inside the tendon, hence making the tendon more prepared to handle heavier loads since now all the collagen fibers bear the load equally. The rubber band also helps in two ways. Firstly, because injured tendons usually swell, which causes them to go out of their place, hence causing even more irritation and damage when under load. Secondly, because the pressure pushes the tendon and the tendon fascia together, hence giving the tendon additional strength from this fascia which surrounds it. Some people theorize that these type of pressure solutions help because they mask the pain with the compression. But this theory fails to explain how the tendon, when compressed, is able to heal while still being used as like before when injured, therefore showing that the compression is not just masking the pain but actually mechanically helping the tendon itself. Lastly, regarding the tendon, if the pain gets worse even though warming up, compression, and deloading, you need to give it more rest and avoid heavy exercises which stress it, since you are dealing with a more severe tendon injury, which also warrants seeing a doctor or physiotherapist to check for a possible more serious tendon injury. If the pain did not improve with the rubber band and warming up, then the cause is most likely the ligament. Note that unlike tendons, ligaments do not improve that much from warming up nor compression, because reason 1. Raising temperature by warming up doesn't significantly help ligaments because they are not contractive tissue, which means they don't actively move or generate heat during warm up. As a result, they warm up far less, and hence the temperature increase they do get from surrounding muscles has minimal effect on them. Reason 2. Aligning collagen fibers through submaximal loading doesn't benefit ligaments because they are not significantly loaded during normal movements. Ligaments engage meaningfully only when the joint is hyperextended, twisted, or pulled, so central warm-up movements don't stimulate or prepare them the way they do with the tendons. Reason 3. Keeping swollen ligaments in place with pressure is not relevant because ligament pain is not caused by tissue displacement because ligaments are extremely short compared to tendons, going directly from point A to B, which makes displacement practically impossible. Reason 4. Pushing fascia into the ligament is not a thing with ligaments because they do not have fascia the way muscles and tendons do. Note that ligaments are located deep inside the joint, often in between bones and other tissue, which makes them less accessible to surface level compression. So to protect the ligament and let it heal, the solution is to refrain from stressing them. This means that 1. You avoid twisting movements, heavy grip work, ulnar deviation, meaning bending your wrist toward the pinky finger side. 2. You use a rigid wrist brace that prevents side-to-side movement. 3. You rest from all activities that cause pain. Ligaments need time and unloading to recover. If the pain persists for several weeks despite rest, or if you feel clicking, popping, weakness, or notice increased instability in the wrist joint, then it's worth seeing a doctor or physiotherapist to check for the possible more serious tear. In all this, do not forget the essentials. Nutrition plays a key role in tissue healing, whether we're talking about skin, muscle, tendon, ligament, or even cartilage. Your body needs essential amino acids for tissue repair, and these come from the protein you consume. Therefore, it's important to eat high-protein diet during any kind of tissue recovery. In addition, certain nutrients and compounds can support collagen-based tissue repair, just as 1. Collagen peptides, which you can get from bone broth or collagen supplements. By the way, note that all meat has collagen in it. For example, beef has about 4% collagen in it. So if on its meat, they will get collagen from it too. 2. Cartilage-rich foods like slow-cooked meat with joints and connective tissue or supplements which contain isolated cartilage compounds like glucosamine, chondroitin, and hyaluronic acid, which may help support joint recovery, especially if the injury involves ligaments or joint structures. 3. Omega-3 fats, which work as anti-inflammatory. 4. Vitamin C, which is essential for collagen synthesis and has also a modest anti-inflammatory effect too. Lastly, one more thing you can do to aid your tendon healing, aside from the nutritional points and protective measures which I already went over. Using the Alfredson protocol for Achilles tendinopathy, which I have modified to fit the tendon injury we are talking about, here is a protocol to follow to speed up your flexor carpi ulnaris tendon healing even further. 1. Place the rubber band on your wrist. 2. Perform extremely lightweight warm-up wrist curls which do not cause you any type of pain. 3. Choose the smallest weight that produces mild, tolerable pain without sharp or worsening discomfort. 4. Help the weight up with your other arm to the full contracted wrist curl position. 5. Lower the weight slowly with the injured arm until your wrist is straight, but no further. 6. Help the weight up to the beginning position with your other arm and repeat this 14 times. So in total, 15 repetitions. 7. Repeat this set of 15 repetitions until you have done 3 sets. 8. Repeat these 3 sets 2 times a day, daily, for optimal recovery. Slight soreness after this is okay, but increased pain the next day or during daily tasks may signal overdoing it, so downgrade frequency to fit your body. Additional clarifications. Firstly, note that the wrist curl is to be performed so that your forearm is in 45-degree angle pointing down, so that there is adequate tension on the tendon during the entire range of motion we are performing. Secondly, since the flexor carpi ulnaris tendon is prone to pressing against the end of the ulna bone in the fully extended wrist position, compared to the Achilles tendon for which the Alfredson protocol is designed, we do not allow the wrist to go over to the straight wrist position to avoid damaging the tendon due to bone compression. Thirdly, if your condition is so painful that the lowering down of the weight causes too much pain altogether, you can do the previously mentioned protocol by switching the lowering down to a static hold of 15 seconds in the almost straight wrist position with a weight which you can tolerate but which still causes some pain, meaning a weight which causes the smallest amount of pain but is still causing some pain. Even though, in honesty, if your pain is this bad, you should immediately go and show that wrist to a doctor and get a personalized to you instruction from him. Lastly, a final word of wisdom. Never bite the hand that feeds you. Subscribe to my channel and like the video to help my channel out. I wish you a speedy recovery with your injury and hope this video was helpful to you. See you in the next video.